Good morning, Mr. Chair, Commissioners. We handed out the latest statistics about the positive cases. Those no longer, as you can see, those no longer needing isolation, or in some instances you see that it's called recovered. So we had 480 and now 425 are out of isolation. So that's good. Just 25 active cases at this point, and 30 deaths. All deaths are unfortunate, and we feel for the families, of course, that lost their loved ones to COVID, but those 30 deaths are mostly in long-term care, if not all. So that's, again, with their compromised health conditions and the age, that's always a factor in trying to fight this virus. So that's what we have for the deaths. There's been a couple of deaths in Minnesota that have had no health conditions and are in their 30s and 40s. So there are still some people that can die from this virus that have no health conditions, so which is unfortunate. And you can see the numbers as we continue doing the testing. There still is the ramp up of testing both on the North Dakota side and the Minnesota side. So you see the cases will continue to rise as well, but the people that are recovering are also there on the green line, so no longer needing isolation, so that's continuing to rise. And then the deaths are still remaining fairly low. In the hospital systems at Sanford and Essentia, they're still saying, they're not overloaded with their ICU beds and their hospitalizations for COVID. So that's still good that we aren't overwhelming our hospital system. So that's a positive thing in our area. And then you can see on the little graph, it shows from May 18th, their number of cases and deaths, and then up through June 8th. So you see how the case counts are continuing. And then you see the ages on the back of the sheet. It shows still in our area, the largest age group is the 20 to 29 and then the 30 to 39. So those folks are still acquiring the virus, but they're also recovering with usually no hospitalization. And the likely exposure continues. Most of it is community. We do know it's community spread. Congregate care living centers, so residents and staff, so 35% in that area, which we knew was going to be one of our hot spots, is our congregate care settings. So that's not unusual that we have the numbers in those various settings. So any questions on the data? So as the businesses open up, and we can talk about tomorrow, Governor Walz is moving to a new phase. So we are watching, because across the country we see as things open up and people become a little bit more complacent, we might see an increase in spread. So we'll be watching our area, and of course in the Fargo area, they've already opened up businesses and prior to Minnesota doing that. So we're all watching across the metro area about, are we going to see an increase in spread as people are congregating more frequently? Churches are opening up. We know that when you sing, the spread of that virus goes further and there's more chance of spreading the virus. So we'll be watching that area as well. So we continue to talk about the same message is wash your hands, wear your mask, 6-foot distancing, so that hasn't changed at all. And maybe Jamie can talk about some of that, information about what we're seeing. Yeah.
Good morning.
Morning, Jamie.
Kathy and I were talking this morning, and I decided I would address the asymptomatic spread that we're hearing in the media right now. And it can be a challenge for us at the local level because of the information that is out there publicly and what is credible and what is not. And so the World Health Organization is, what's out there is that this asymptomatic spread is very rarely contagious, basically, from one person to the next if a person is asymptomatic. And so looking at our CDC and our MDH websites, that is not there. The debate that's going on right now is that that's what science is all about. They come up with something and then they challenge it. And so we all remember that from our elementary school science, is that they try to prove themselves wrong is what they're actually trying to do. So until we're told at the state level or even at the CDC level that asymptomatic spread is not a risk, we really need to focus on continuing to try to maintain that social distancing. And also a key part of that is the case investigation and the contact tracing. And so we've worked really hard at the local level to connect with North Dakota. The proper channel is, because we have people that are going across the border and taking advantage of testing opportunities in North Dakota, our state health department is working with our staff that are currently trained to do case investigation and contact tracing. And so that has really provided us with an opportunity to respond quicker. And so that is happening at the local level. The key is really about doing that contact tracing and getting in touch with people quickly to educate them. And so really that's the message that I want to share, is until the CDC or the Minnesota Department of Health tell us that asymptomatic spread can't happen, the best thing we can do is to be on top of that. So thanks for that.
Okay.
Mr. Chairman?
Yes.
So the, has anybody looked at the WHO's scientific evidence? Is that being reviewed? Do they, are they looking at some places that may have seen the virus earlier than what the United States has seen? Or I've heard the same thing, but I haven't read the articles. You just see the headlines, and so I'm curious about that in terms of what scientific evidence they've put out to back that.
And my assumption would be yes, because that's what science does. You know, they challenge
Right.
each other. And so what I've seen is that it's not strong enough evidence, basically, to discount it. And so more research needs to be done.
It's probably encouraging.
It's encouraging.
Right? For them to
Exactly.
put that out,
Probably.
I would think that it would. Of course, there's a lot of differing opinions on the
Right.
World Health Organization, but
And it, you know, it, like you said, it's encouraging and we're hopeful, and that does make us feel like we can control it a little better. But again, more science needs to be done, and that's really what research is all about. So they challenge each other, and that's how they know for sure,
Sure.
how it's being transmitted. So.
Okay, Cheryl will talk a little bit about.
Good morning. So Jamie was talking about, people going over to North Dakota for testing and that. And I did speak a little bit about static site testing that was going on over in Fargo at last week's board meeting. And I just wanted to also mention that because of the Red River Valley Task Force, we're able to provide an opportunity for businesses in Clay County, as well as some of our healthcare workers that may have not been able to get tested. We did have the National Guard that came in that is still continuing to do testing at our long-term care facilities and assisted living. But we have a number of adult corporate foster care facilities that have not been able to participate in that until now. So it is continuing to grow. I am in very frequent contact with all of these facilities, and so many of those healthcare workers now are able to sign up and go over to get testing done, and then we're able to follow up with those results as part of our case investigation and contact tracing. I also wanted to just mention, as Kathy was talking about, more of our businesses opening up and that people are returning to work, and we are still getting some calls from people who are concerned if they have been a close contact of someone that has been deemed positive. There's a little bit of confusion on how long they need to stay at home. So for anyone who is positive generally and they have symptoms, it is 10 days for them to stay at home, and then plus 3 days without a fever, without using fever-reducing medication. And then if they are positive and they do not have any symptoms and they are part of critical staffing infrastructure, say they are a healthcare worker, And if they are not able to return to work, they would be in a critical spot for staffing. As long as they are asymptomatic and are able to wear the proper PPE, they can return to work. If at some time during that work day or within the following couple of weeks they would have any type of symptoms, they would be sent home immediately. For the people that have had close contact with someone who is positive with symptoms, then they are asked to stay home for 14 days.
Okay, thank you.
Any questions?
Yeah, are you gonna do any more TV appearances? or-
Only if Kathy makes me.
Hey, on that testing we did a couple of weeks ago, did we report on the results or don't we get them or? Well,
The
we-
mass testing at the Armory? Is that what
We had
you're talking?
845 tested with any.
Yeah, about 840 tests, and only 1% was positive.
1%.
So all of those people have been notified. There was some North Dakota folks that came over as well. They were not turning anyone away, so it was both Minnesota and North Dakota people that came through.
Okay,
And so the static testing, like Cheryl talked about, isn't a mass testing. So those folks, and that's on the Fargo side, those are appointment only. We haven't, the governor hasn't issued any further mass testing events like the Armory one. So we'll see if he determines there's a need for that. But the positive amounts were low throughout Minnesota.
So if I can, the positive tests, were those then put in to start the contact tracing?
Yes.
And you said that there were maybe a few that came from North Dakota. Does somebody notify that side too, so the contracting,
Yes.
contact tracing goes over there too?
That's correct. And we have
If
a
you don't do
great,
that, then you're.
right, we have a lead in, one of my staff is a lead in case investigation and contact tracing, and actually is a trainer, so she's training some of my other staff, and we have a few that will come on. I'm working with Darren on taking a few people from outside our employment, so we can hire a few more that can take that on, because it's a 7-day-a-week process, so it's a lot of work, and there's a lot of contacts. That takes a long time because there's a lot of phone calls. People are afraid sometimes to answer the phone when they don't know the number that's calling them, and they're still afraid even if they hear, well, this is the Public Health Department or this is Minnesota Department of Health calling. So we lose some people. It's the same on the Fargo side. We lose people to they just don't answer their phones. They're afraid to answer their phones. So we encourage people, if they're getting a call from Public Health or Minnesota Department of Health, to at least pick up the call, and so we can provide information to them. So we're working very diligently on getting those cases contacted right away, and then the contact tracing happens as well. And Minnesota Department of Health is still doing a large portion across the state along with the local public health agencies. So we're working in partner with them. So that contact tracing and case investigation should be much improved from when it previously was.
Mr. Chair,
yes.
a few weeks ago, we authorized use of funds to hire anyone locally to do that. Is that something that you needed to use or not?
Yes, that's working with Darren on that. I've received information from Minnesota Department of Health of how they're reimbursing those folks that they've hired. So we have the reimbursement rates, and so Darren and I are working on the process to onboard them for a temporary or seasonal process. So 90 days of working as much as we need them to. It's particularly important on the weekends, because so much of the team is working the 5 days a week and then have to put in the weekend hours for contact tracing. So yes, thanks for asking.
Okay.
We are trying to ramp that up. Our staff are not able to do it full-time because they have their other work that they need to do as well. So it's a lot of part-time. And then there was questions about the antibody testing, I believe last meeting or maybe the meeting before, and the health systems and family health care are doing the antibody testing, but it's typically with their healthcare provider that's requesting it. So with Sanford and Essentia, if your healthcare provider requests, or if you request of your healthcare provider that you're interested in having an antibody test, they may or may not say that's a good idea. That medical community is, they'll use the antibody testing and then also the clinical follow-up to determine who has recovered and how long they're at lower risk of infection. So that would be part of some of the studies they're doing, because it's not definitive about how much protection you have and would you be protected entirely if you have a second infection. So that helps that healthcare system to determine that. I know Family Healthcare has done some antibody testing with some of at their testing site as well. And then, as you can see from our Stay Safe Minnesota, the governor's moving to phase 3 tomorrow. So that's when the restaurants and bars have the ability to open up to a percentage, 50% capacity, indoors and outdoors. We had some concerns from some business owners that they didn't have a patio, so they really couldn't do the outdoor patio opening up to, to allow their patrons to come. But now this will change that with their 50% capacity and, of course, not to exceed 250. So that gives the opportunity for the restaurants and bars to have provide some service. And the salons and barbershops kind of are still doing that 50%. So he's really opening up some of in fitness centers and gyms, he's opening up some of the establishments so they can actually do, they're still needing to do the 6-foot distancing, they're still requiring their workers to wear masks, but there at least is some opening up to, it's been challenging to be on this in our metro area when you're competing against businesses and establishments in Fargo who have been able to open up sooner than Moorhead. So, that's been challenging for people and certainly stressful. My food pool and lodging inspectors have been fielding calls because there's concerns. There's either complaints about establishments already opened and providing service, and there's complaints about people not wearing masks that are workers, so they're fielding all of those calls, and they've worked with the attorney's office as well to determine kind of follow-ups to those complaints and who enforces some of that. But tomorrow will alleviate some of that for the establishment. So.
My question, who enforces all this stuff? Is there anybody designated yet to enforce this?
Well, for the restaurants, that's what my inspectors are working on. They're working with MDH, and then they also have been communicating with the attorney's office to determine, who's going to follow up on some of that COVID, response for those establishments. So that's still in the works. MDH is still working through that process. So right now, the follow-up is they're really making the calls and informing the establishments about what the recommendations are and requirements are from the governor. So
are there fines for that or stuff if you do go over your 50%?
We don't have any fines established at this time, so that's more to work on. That they'll determine if that's because our contract is with MDH, Minnesota Department of Health. So we need to work with them to determine if there is going to be any fines or not. So right now there isn't. There's just more education and follow-up.
Thank you. Any questions for staff? Anything further?
There's no
I guess I
press
have a
conference
question.
tomorrow. They canceled the press conference because of other things going on, so there won't be a press conference tomorrow.
Go ahead, Jenny.
In terms of what the county has for a PPE stockpile that I'm sure you share with the law enforcement, or I'm not sure what, my guess is that has been depleted because of the last few months. Is there any work that you're doing to re-establish that going forward?
Cheryl can talk about that. That's kind of in her area.
So we did receive a cache or a supply of PPE from our West Central Healthcare Coalition. We have not depleted that entirely. It's been allocated very carefully to try and preserve as much of that supply as we can. I also am in contact with Gabe, our county emergency manager, because he has received over time some supplies of PPE, so we work together. If we have a facility that has a request for something that we do not have in stock, then we go back to our West Central Healthcare Coalition, and there is a process for facilities to request that too. So if our regional healthcare coalition does not have that supplied, then it can be requested from the state level as well.
Okay. I just, in the news, you've seen different departments in different cities testing positive, and so I want to make sure that our employees have that if they need that. Yeah, I understand that we're trying to use it carefully and whatnot, but if it's available, let's allow that.
And Gabe has gotten supplies for all the employees, so when we open up more in our county, that our employees will have that, the supply that they need. And maybe, Cheryl, I was just thinking of, maybe you want to mention the fit testing that we...
Sure. So another opportunity from the Red River Valley Task Force is an individual from the North Dakota Department of Health has offered to come over and do fit testing, which is something that is necessary when a person wears an N95 to ensure that you have a proper fit. And so he is working with me and going to be contacting facilities that may request some fit testing so that they can use properly the N95 supply that they have. And so that process is just getting started. He's just starting to make contacts with facilities, and then he will basically do a train the trainer thing. So they will designate a person that can take the training and then can proceed forth with training the rest of their staff.
Another benefit for us to have that Red River Valley Task Force and to be able to share resources without having the expense of that. So that's been great.
Okay. All righty. Thank you.
Thank you.
Thanks so much for keeping us up to date on this and for doing the work that you're doing on it.
And I want to thank all my team. These are two of the members, and of course Josh, and there's a number of other people in our department that are working vigorously around, often 7 days a week with COVID. And then, of course, we work closely with Gabe, our emergency manager. So, and then we work with Chad Stanglin from the city of Moorhead as well. So we have a team that continues to work, and there's a lot of work to go around. So I appreciate all of them working on this diligently. So.
Mr. Chair, I know you've announced that they're not having the task force meeting tomorrow. I'm not sure how we want to go, if we keep this as a standing update on every board, or now that we're in phase 3 tomorrow, I mean, if we want to do it as bigger issues come up, I'll leave that up to you, but.
I like to still see the data that you've been bringing us, and I would certainly think for the next 3 or 4 weeks it would be nice to still see that, at least
Sure.
As things open up more. If there's anything that's positive, we'd like to know about it. If there is anything that isn't positive,
Sure.
we need to know about it. So.
Okay. Sounds
Okay.
good. Thank you.
Thanks so much.